in cancer, leukemia cancer. But this one, the white one with white and in the center, help a lot for women that are having bleeding or having spotting. If you look at the signature of the plant, it will tell you what it will work. If you look at it well here, you see that white spotting. But I'm calling people, researchers, to come to help us, because planting, in order to get this very one to achieve more, is very hard, because we have to plant the pure white periwinkle and plant the pink. The root now will jam in order to get this, but it's very hard to get. And this spotted white is powerful, mostly for women that are having, maybe they're pregnant, they're having bleeding. Once you both the root, the leaf, the flower, once you boil it and give the person, the bleeding will stop immediately. So I'm pleading spirited individual, knows all people that love this thing that I'm doing, to come and assist me in doing farm. We have teas, but we don't, how we can germinate this in a larger quantity to help humanity. This one help for children that are having pre-wean. That's why if you listen to the signature theory of the plant, you see it's pre-wean, but it's Vika. But every place they call it pre-wee-wee. So it's pre-wean. The theory will tell you the part of the body. If you are passing urine frequently, this one will take care of it. But if you are having bleeding, nose bleeding, you are vomiting out blood, this one will take care. If you look at two of them, this one help, the pink one help those people that are having low blood circulation. If you see that red spot at the center, you see as it diminishes slowly to the petals. So every plant here has a particular thing to do. But I'm emphasizing on food. Every food you eat will determine how you will be next tomorrow. So I'm now pleading people to go back to, to go back to their roots and eat those things that their forefathers have been eating. From that, they won't have any problem. That is, you know, all these things that I'm doing, I inherited it from my great-grandparents. My great-grandmother was a herbalist. My great-great-great-grandparents, they're all herbalists. But now, I'm modifying it. And thanks be to DIA, Drug Information, which I'm a member, that helped me, and the University of Nigeria, Soka, that they are helping me in all these researches that I'm doing. My children learn this from me, and I have 3 medical doctors, my children. Now they have passed me, they can do operation in a theater. I can't operate. They can do, give somebody herbs, because as from their childhood, they know the value of this herb. They know what we use it for. They can use other means that so many medical doctors, all those cases that define orthodox medicine, like the cancerous man that they queried cancer from Bishop Shanahan Hospital to UNTH, from UNTH to my place, to orthopedic, from orthopedic to my place. The man, I treated the man, they showed the man on CNN. And a lady that I discussed this morning with mentioned that they saw me at America, where they were showing my program. One is that there is life implant.
This tree was used to heal the cancer patient.
We handle prostate disorder in any form. I've been warning people both on the newspaper, television, and radio not to do prostate operation.
My experience is first of all, I came in here, I had some, like the doctor diagnosed me that I have prostate cancer according to the report. I had a lot of pains and symptoms here and there. I have a cramp in the toes, and I have a bone metastasis, and I have fistulas because the urine is not flowing. The urine was flowing back according to the test they conducted. So they had to puncture my kidney from behind and then pass the urine into a bag. So I normally discharge it when it is full. So that was all, and I came back with all these problems from Germany. I've been there for 10 months in admission in Munich, Germany. So I came here, I've been receiving treatment, and most of the problems are being solved and getting resolved. So like when I came here, I could not breathe well because the diagnosis showed that I had infection in the lungs and heart. So that makes it difficult for me to breathe, and I'm always very tired. I'm regaining strength, so I'm feeling better. When I came here, I was in severe pains. So it was very difficult for me to pass through. But it is better now. I'm no longer
Using the clutches?
Using my clutches. And this is the clutches. I brought them back from Germany. I'm no longer using them, and I have thrown them away, and that is exactly what I was praying for. My experience is that at the first time I have this, I was diagnosed that I have prostate cancer. I was told by the doctor, the professor here in Nigeria, in Lagos precisely, that they have to be giving me extra seed, which is what is it called? It's because they said hormone, yes, because they said this sickness is only for men, not for women. So that they will be giving me this hormone. And this hormone will be bulging out my breast. So as I'm taking it, that's why my breast is coming out. But like now, I have stopped taking it. And with the treatments I'm getting here, it is going that.
I'm going to remind you people now to know that in Africa, we have two types of prostate disorder. The one that maybe done by people, and the one that is natural. The one that is done by people, if you are doing anything orthodox to remove it, it won't work. In Igbo we have C.P.H.A. They will tell you if you dance too much, they will do you something that you will not pass urine, you will not pass feces. If these things happen now, if you rush to hospital, it will not work. That's why here we have what we call Ntuze, and we have what we call Ulodi. These two things, they use Ulodi to close somebody's fuses, or that's why they have reading. We learn, we know the plans through the folk tales that other people do. They tell you that in olden days, tortoise has many parts. They have filled all animals in folk song, that they clear a place so that they will not go, nobody will pass through. But tortoise went to pass through. After that, moved to different lie